The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and it's a pleasure to be hosting this podcast, and thanks to everyone for listening in. We're in part 2 this week of a special 2-part election year series. Last week, we hope you did listen to the podcast, but just as a quick recap, we talked about election 2024 and about how close the presidential race is. Again, razor-thin popular vote numbers. The Electoral College will probably come down to a handful of states. We don't know yet if former President Trump's fraud conviction in New York will have major impact. The Republicans say no. The Democrats say yes. Polls say there could be some impact, but we just don't know how that fraud conviction would be weighed against some other issues that are dominant in the campaign. So the presidency is very much a toss-up, at least right now. In the Senate, the Republicans are certainly favored to win. Democrats would largely have to sweep all of their existing open seats to maintain control, and perhaps at best they'd need the presidency to control the Senate chamber as well. In the House, the problem is that state legislatures have gerrymandered districts, so much so that about 90% of all House districts or races are really not competitive at all. It's essentially an anointing of either the Democrat or Republican in the district to go into Congress. There are about 50 or so seats that are at all competitive or toss-ups. I would say that the GOP may be favored to retain control of the House, but it's very clear that even control of the House will be very, very tight. It could come down to some very competitive districts for control over the House. In the second half of that podcast, we sort of went through, and I talked about how I think healthcare could be a bit of a sleeper issue. And it really ties to the fact that the election, at least in the presidency and the House, and even in some Senate races, is so close. It's just so hard to tell, just like we've seen the last couple of years. And so I believe in some more moderate counties, districts, states, swing states as an example, that people are probably a little more moderate in their outlook. And I think that while pocketbook issues and immigration sort of dominate, that healthcare could become one of those sleeper issues and help decide the election in some of these swing areas. And I would also argue, as I pointed out in the podcast, that healthcare is a bit of an economic issue and it's on people's minds. So there's a number of polls out there. There's a Kaiser Family Foundation tracking poll, which sort of indicates that whether you're a Democrat, Republican, or an independent, you do care deeply about issues like Medicare and Medicaid, and even to some degree the Affordable Care Act. So I really do believe healthcare will be an issue in some of these tight areas of the country and could actually be a decider out there. So that's just a quick couple of minute recap of part 1. I'd invite you to go to last week's podcast and listen more into that roughly 50-minute or so podcast. Today in part 2, as I promised, we're really talking about my view of what healthcare reform should be. And I believe it could be a bipartisan issue. I'm not foolish enough to think that my proposal or anything like it, or even real healthcare reform, will come to fruition at any time in the remainder part of this year. But as I've stated often, I am sort of an atypical Republican. I believe in universal access. I believe in health reform. I believe that everyone should have health care. I do not believe it's a commodity like many people in my party believe. So I am never afraid to go out there, lay out what I believe in hopes that someday we'll have the right people in Congress where we could actually undertake healthcare reform. And so today I'm just going to be going through my proposed plan. Much of it is taken from my book, The Healthcare Labyrinth, A Guide to Navigating Health Plans and Fixing American Health Insurance. The book is available at leading book publishers, and it's also available at my website, the Healthcare Labyrinth, healthcarelabyrinth.com, which is known as the Healthcare Labyrinth website. So go to healthcarelabyrinth.com if you'd like to hear a little more about the book and how to purchase it. And as you know, the website has weekday daily news feeds, 2 blogs a week. We do this podcast, both available at the website as well as at leading podcast sites and apps. So to start out my modest proposal for healthcare reform before we take a break, I am going to sort of go into a few facts. And some of these facts you've heard before, but I'd like to reiterate them and introduce a couple of new ones because I think these facts are really, really important. So first fact, a private health insurance system that prioritizes universal affordable access can work. And I've told you that there are basically 3 types of systems in the developed world: socialized medicine, single payer, and private affordable universal access. And all have really shown the ability to be cost effective and have high quality. Indeed, in a recent Commonwealth Fund analysis, which I talk about often on this podcast, the analysis was of healthcare systems in the developed world. All 3 of these system types I told you about were represented among the top 5 performing countries for efficiency and outcomes. So it's not just that a socialized medicine or a single payer or a private affordable universal access system is better than the next. They all perform well. And countries in Europe largely have all 3 systems, and they do succeed pretty well. And so that's sort of fact number 1. We have not adopted any of those approaches and have a massively fragmented system without true affordable universal access. And we'll talk more about that in a minute as well. Fact number 2, as of 2022, we spent 17.3% of our gross domestic product on our healthcare system. Well, most other developed nations spent between 8.8% and 12.8%. Per capita spending comparisons tell a similar story. Overall, what these statistics tell us is that this makes us anywhere from 35% to 97% more expensive than other developed countries' healthcare systems. The Organization for Economic Cooperation and Development country averages 9.6%, which then would make the U.S. Roughly 80% more in terms of healthcare spending than the average for OECD nations, which are largely developed nations. Fact number 3, our quality and efficiency are ranked dead last in that Commonwealth study and other studies of developed countries' healthcare systems. In fact, we are so bad in terms of outcomes that we are an outlier against those developed countries that registered the worst. And that really says something. We're spending the most, almost 100% more, and our outcomes are dead last, and they're an outlier in terms of those low categories. Fact number 4 here, a public-private accountability system is emerging in the United States, and I believe it's a positive for the nation. It essentially leverages the oversight of the Centers for Medicare and Medicaid Services and the Department of Health and Human Services and some other federal and state agencies with the innovation of private health plans. Private health plans run the insurance system. Private providers essentially provide the care, but government agencies have created a very good blueprint of accountability and how to make sure that we're driving for efficiency and quality. Again, we haven't gotten to efficiency and quality, but there is this accountability oversight system from federal and state agencies that are emerging, and I think it's a very good way of doing it. The next fact here, I think we're up to fact number 5, if I'm not mistaken, is a private model fits America, and I think it is far superior to a single payer Medicare for all type model. I don't think the American public would ever support socialized medicine, and I think the fact that if Medicare for all, and apologies to my friend Bernie Sanders out there, but if a single payer Medicare for all was set up and it was based on the Medicare fee-for-service system, which in many ways it would have to be, I just think it would be tragically expensive, and the quality in our system would be still very, very poor. And I don't believe that system is actually cut out to actually improve quality or actually get to cost effectiveness. They have pilots running in the system. I don't believe they're doing terribly well. I would never shut them down because that system's going to be with us. But I think that tells us a great deal that the Medicare system as a foundation of the proposed single-payer Medicare for all system would just not work. The next fact, America should focus on 3 areas. Again, from my book, The Healthcare Labyrinth. I believe the 3 keys to reform are driving affordable universal access, reforming price, and pivoting to care management from what is today our obsession with utilization management and prior authorization. All 3 of these are necessary to focus on upfront wellness and prevention and really bend the cost curve. And so prior authorization may always be with us, but I believe that the administrative costs of PA and the amount it saves would be dwarfed by just pivoting and focusing like other developed countries do on wellness, prevention, primary care, and things like that. It doesn't mean we don't need specialists or hospitals, but if we really made the right kind of investments in upfront care, care management, wellness, and prevention, I think our savings would be so much more than is derived from this upfront utilization management that we have. Next fact, price transparency, site-neutral payments, value-based payments in care, and consumerism and interoperability are all a must in our system. We need price transparency. We need payments in our system that pay the same rate regardless of the place of service, whether it's physician, ambulatory setting, or outpatient hospital. We need to move better toward value-based payments and abandon our fee-for-service transactional system. We need to bring consumerism into healthcare. If we can go on and make educated decisions about least costly furniture and maybe a value-based purchase on furniture, which you may pay a little more for more quality, I think if we had price transparency, we could introduce consumerism and we could have personal responsibility in healthcare, and that would help a great deal as well. And lastly, interoperability. We have so much data out there. We don't share that data. That data is rich with ways to improve care and even lower costs. So we need to create an interoperability world where providers and payers and payers and payers and providers are talking to each other in real time and using data the way it really needs to be. Next, the next fact, we should adopt a uniform national and or regional healthcare price payment system. I believe that this current pricing mechanism where prices are extremely deviant between regions of the country, prices even within regions of the country can be very different. And what one payer pays a hospital may be very different than what another payer pays a hospital. And the rates that payers negotiate for their hospital networks, as an example, can be extremely disparate too. This creates a huge administrative burden on the system, and it creates an environment where prices go up dramatically year to year, whether it's hospitals or other providers. And so if we had fair, uniform pricing and actually blended probably Medicaid, Medicare, and commercial rates, we would not have cost shifts in the system. We would save a great amount on administrative costs. And I think we would have a fairer, cheaper system. And it would also incent hospitals and other institutions to reform. They continue to be bloated and live on very high payments in different areas and are not focused on the bottom line. Next fact, we also have to tackle drug price reform. And I happen to believe that the Inflation Reduction Act's Medicare drug pricing negotiations provide a good foundation that mirrors what other developed countries do for their entire systems. And we should really extend that kind of negotiation system to all commercial, all Medicaid, all Medicare, and have a uniform system in terms of how we set drug prices in the country as well. Next fact, we do not have to abandon employer-sponsored coverage. Why do I say that? Because I think, number one, private insurance probably matches America the best, and there are proven private models out there. Our employer-sponsored coverage system is relatively popular with Americans. Sure, people complain about their health plans, but if you really dig into the polling data, people tend to think that their employer coverage is actually a good thing. But what I would say is employer-sponsored coverage leaves many people out of health coverage. They do not have consistent access to employer-sponsored coverage because they may be retired, they may be disabled, they may be poor and do not work at jobs that have solid employer-sponsored coverage, or they can't afford some of that employer-sponsored coverage. And what I believe we should do is over time is create one master social safety net public insurance program with private managed care delivery to ensure affordable access for Americans. That would take subsidies similar to what we have in the exchanges to ensure consistent access to affordable coverage for everyone, either in an employer-sponsored plan or in this one master social safety net. I've actually stolen this idea a bit from Richard Nixon, who proposed just this: keep employer-sponsored coverage, but have one master social safety net program. That program could be like an exchange or like a national Medicaid program, or it could potentially be Medicaid programs in all the 50 states and continue as a state-federal partnership. But everybody without access should be able to enroll in the system, and it should be means tested, and there should be subsidies that are given for premiums as well as for cost sharing for certain income groups. In the meantime, I think robust Medicaid, children's health insurance, and exchange coverage is key. The tenets of the Affordable Care Act need to be preserved as well. Next fact here: the American public across party lines support access to health care for citizens disenfranchised from affordable access in the employer world. And that includes Republicans by and large. And this is fairly universal. Voters that are Republican, Democrat, Independent, it doesn't matter. They support Medicare, they support Medicaid, and by and large, a majority of citizens support what we're doing in the Affordable Care Act as well. And that's where congressional Republicans, by and large, there are a few exceptions, but that's where congressional Republicans are far more rightist or right-wing compared to the same Republican voters who are out there endorsing pretty affordable universal access for all citizens. Last fact before we take our break. We need to adopt an aging policy to ensure seniors have affordable access to both medical and long-term care. We have an aging boom in the country. People will continue to live longer and longer because of technology. And in truth, our inefficient healthcare system combined with this aging threatens to cripple not only our Medicare and Medicaid systems, but also family budgets, because families tend to take care of the elderly, and they give so much up incomes, for example, to do that. So unless we create a national aging policy and create some buy-in programs to government long-term care, we are going to be in real trouble both on the medical and the long-term care front. So with those facts out there on my plan and what my plan would be in essence, let's take our first break, and then we'll come back to talk a little more about what could be saved. And then later on, we'll talk also about what might be in it for both Democrats and Republicans.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this edition of the Healthcare Labyrinth Podcast. And we just, in that very first part, we talked about some facts and my proposal, my modest proposal, let's call it, in the spirit of Jonathan Swift, about what healthcare reform in America could look like. I'd like to next turn really quickly to what could be saved if my proposal, my modest proposal for healthcare, was adopted. So let's look at the sheer cost difference to understand a little bit about how much could actually be saved. Now, it starts off with the tenet again that there are three working systems out there. Again, socialized medicine, single payer, and private universal affordable access. All of them can be efficient, as the Commonwealth Fund study says, and they also can be of high quality. So there's no reason why America, if they adopted one of those, and I would argue it should be private affordable universal access, could not be as efficient as the rest of the developed world and have great healthcare outcomes. So what would we save then if we start thinking about what other developed world countries spend? Well, in 2022, we as a nation spent $4.5 trillion on our healthcare system. Again, that's about 17.3% of the economy. If we as a country were able to reduce our healthcare spending as a percentage of GDP from 17.3 to something lower, over time, we would save a lot of money per year. So if we were able to go as low as 8.8%, which is the low in one of the developed world countries, in today's dollars, America would save $2.2 trillion a year in healthcare spending. In essence, free that up in the economy. And that's about half of the 4.5 trillion roughly. Now, if we spent as high as the highest spending developed country, which is 12.8%, we would save somewhere around 1.2 trillion a year. So over time, as we move into this new universal, affordable private access system, and as it matured, we could save between 1.2 and 2.2 trillion dollars annually in healthcare spending. And that is in today's dollars. That would only grow over time. So the stakes are huge. And now I'm going to get into some discussion about what's in it for lawmakers, right? The lawmakers are sort of split to a very progressive left wing today in the Congress and a sort of reactionary right wing in my party, the Republican Party. There's, in truth, very little moderate policy in the middle. It might be said that there are more moderate members in the middle on each side, but they don't really have power. Everything is rather radicalized. So in that spirit, I want to tell you what would be in it for Republicans to adopt my modest healthcare reform proposal, and over time to have the potential to save between 1.2 and 2.2 trillion annually for the economy in healthcare savings. So this is what's in it for the Republicans. The GOP constantly complains about the non-competitiveness of business. To former President Trump's credit, the United States did lower the corporate tax rate from 35% to 21%. Admittedly, due to loopholes and tax credits, many large firms paid considerably less and even zero than that historically. But the realignment brought all businesses in parity with the rest of the world, especially for some of our small and medium-sized businesses that don't get the benefit of all the loopholes and tax credits and were uncompetitive from the standpoint of a corporate rate. They were paying closer to 35% a year, the small and medium-sized businesses in America, and the rest of the world was paying 21%. So to former President Trump's credit, that was a great move to get more toward competitiveness of business. Now, it's always true that America has been pretty competitive because our productivity has always been high. So that helped us out. But more and more, we are seeing some uncompetitiveness. The corporate tax change helped address that. But what is the other source of uncompetitiveness for American businesses? It's the fact that it carries an enormous burden providing employer-sponsored healthcare coverage. Now, I'm the first guy to admit that I don't want to abandon it because I think it's rooted in American values and it works pretty well. The problem is that it's pretty costly. And part of the problem with employer-based coverage is that there's a cost shift from Medicare and Medicaid, which reimburses lower, to employer-sponsored coverage. So it's sort of a double whammy. There's a cost shift and costs are really high, and that's a huge burden for employers to carry. Now, if we were able to save the $1.2 to $2.2 trillion and rationalize our price setting system to have uniform pricing across lines of business, there would be a tremendous burden lifted from the cost of employer-sponsored healthcare coverage. Admittedly, there would be still a cost, which would be different, perhaps, than are done in other developed world countries, but that would make us so much more competitive by rationalizing healthcare. So that's really one part of what's in it for Republicans. And again, it's a popular misconception that somehow businesses save dollar for dollar because healthcare costs are deductible. Well, they are deductible, but it's not a tax credit. They are getting credit on their tax rate now of 21% as an example, but they're still paying 80% of exorbitant costs today in terms of employer-sponsored healthcare coverage. And this is not the case, obviously, in other developed countries. So we still may have a bit of a burden because we still want to remain with employer-sponsored healthcare coverage. But if we reform the system, costs would go down, the cost shift would end, and we would be so much more competitive, even with the lowering of the corporate tax rate. So all of that comes together to undermine American competitiveness abroad, as I pointed out. And just in summary, again, my proposal would significantly address the cost of healthcare generally and the cost shift specifically. And Republicans would be able to ballyhoo that businesses now are far more competitive. Great stuff. So let's turn to what would be in it for Democrats if my modest proposal were adopted. While Republicans would object to spending all of the GDP savings in healthcare savings, a strong case could be made to reinvest a piece of the savings in needed areas of healthcare and society in general. So this is where I think Democrats would come on board. Social spending could be enhanced in critical areas, in part to address social determinant barriers to good health. The COVID pandemic also showed that our public health infrastructure, is woefully inadequate. The next pandemic and the pandemic after that could turn out much worse because, again, our overall public health infrastructure is simply not there. It's incredibly devolved to states, and many states do not have an adequate public health infrastructure. And the fact that we heard the White House talking every day during COVID was sort of a signal, too, that we did not have a very good federal structure, or at least a robust infrastructure at the federal level to respond to these things. So some social spending in a part to address social determinants. It could also go toward aging, because I talked about we need investments there, and investment in public health infrastructure could all be some things that Democrats could sign on and spend a piece of the GDP savings when healthcare costs go down. I would also note that I believe we need more government research into disease and drugs. And we also need to invest, again, in our aging. So all of those kind of spending packages could be developed, and the Democrats would be delighted to spend a piece of that GDP savings. I would also note that a piece of the savings could also be invested in an on-demand and high-tech system. One of the criticisms of both the socialized medicine and single-payer systems is that they do have fairly deliberate ration systems. And in that case, what happens is there is a paucity of specialty level services and access in general, and technology is oftentimes not prioritized. So what we could do is not only spend a tiny of it on some of the things I talked about up there, but we could continue to differentiate ourselves even with a cheaper system to have sort of more of an on-demand technology-driven system. It doesn't have to be excessive, but we could maybe give a piece, a point or two back to the system to ensure the on-demand and tech-driven nature, and also perhaps better access to drugs. I want to see drug price control, but I think there could be slightly better access to drugs in the system. So again, to sum it up, the Republicans get better business competitiveness. The Democrats get to spend a piece of the GDP savings on some very targeted investments in government spending, and we could even spend a couple of points, a point or two, let's say, on investing so we keep aspects of the on-demand, technology-driven, and some better access to drug coverage. With that, I'd like to take our second break here before we come back and just sort of sum up the podcast.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and I hope you're enjoying this podcast about my views on healthcare reform. And just to sum up here, you sort of heard the pitch, you've heard the facts, you've heard my ideas for a middle ground on healthcare. You've heard a little bit about why I think Republicans would be happy making business more competitive. Democrats could be happy by freeing up some dollars to spend on critical social and other investments. And number three, how we could still keep a little bit of this quote unquote savings and reinvest it in keeping on-demand, technology-driven, and some drug investments. And so just to sum up here, why does this likely not have a shot this year or perhaps in the near term? And so the complexity of all this is, again, and I've referenced this, is that the two parties would need to compromise. Again, most congressional Republicans view health insurance as a commodity where somebody has to pull themselves up by their own bootstraps and buy healthcare if they become rich enough. And few moderate Republicans remain, and the right of my party philosophy just prevails on healthcare. And I would really ask, where is the compassion in this stand? And I would note again that most Republican voters favor strong universal access to healthcare, especially for those in need. At the same time, I would note that many Democrats seem to endorse excess and would, given their gumption, would create an unaccountable healthcare system. And that's really terrible because I believe we're on a crash course in terms of our unfunded liabilities in general. And if they created an even more unaccountable healthcare system, it would only mean deeper pain and deeper cuts in the future because it would just simply be unaffordable. And again, in the Democratic Party, the progressives right now dwarf moderate views in the party. So they are pushing these ideas of Medicare for all. They are pushing for an unaccountable system that simply adds and adds and adds things to the system that would ultimately, again, make it unaccountable and make it unaffordable. But there could be enough in my proposal in time, I would argue, to get people to the table to talk about this middle ground healthcare reform that, as I've pointed out, would endorse affordable universal access with adequate subsidies. It would tackle price with uniform national regional price setting. It would pivot from utilization management to care management, wellness, and prevention. And it would create, I think, those political win-wins we talked about. It would absolutely take a lot of political courage and strong leadership. But it's time for American voters to tell their lawmakers, their president, whoever that may be, that they need to show that political courage and that strong leadership. Because healthcare reform is something whose time has come. It's been a long time in coming. And again, we won't be able to afford the healthcare system in the future unless we make the right kind of changes. With that, we'll conclude this edition of the Healthcare Labyrinth Podcast, and we'll see you next time. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.